All right. Hey, everybody. This is my first collaborative wide meeting, so I'll take just a minute to introduce myself. My name is Emily Mathias. I am one of the emergency medicine faculty at the University of Michigan. I work clinically in pediatric emergency medicine. Outside of my clinical work, my area of passion, or as my boss wants me to call it, my scholarly interest, is pediatric readiness in community emergency departments. So I'm going to talk to you quickly about the Peds Readiness pilot that we're doing with Medic. So I think somebody talked about this at the spring collaborative meeting, but just a little update. So Medic received 1 year of pilot funding for this project. So we officially started in April. We had initial goals of measuring pediatric readiness at 5 pilot sites. We actually overshot that target and we enrolled 6 sites, so that was great. We started by going to each of those 6 sites and completing baseline pediatric readiness scores, which for those of you who aren't familiar with this space, I won't get too much into details, but we already have a national survey that's used to measure pediatric readiness in emergency departments. It can be accessed at pedsready.org. Please come find me if you have any more questions about that, but thankfully we didn't have to reinvent the wheel on that. So we used that to complete baseline scores at each of the sites. And then we are kind of in the process right now of helping each of those sites identify opportunities for improvement, helping them to support whatever efforts they've identified to improve their pediatric readiness. And then at the end of the pilot, we are going to be reassessing each of those sites to see if they've had any improvement in their scores. Here's some lovely pictures from each of the sites that we have worked with. I got to see some places in Michigan this past summer that I'd never been to before, so love that. So next steps for this work, each of the sites we've had complete impact effort matrices, and they're working on their different improvement activities that they've identified. We're going to be having some group office hours in the coming months, just so we can make this a group effort, so we can kind of have the different sites share what they've learned, kind of share different strategies, and kind of work through any challenges that they might have. And then again, as I said earlier, we're going to be following up with each of those sites. Oh yeah, we're going to be doing scholarships. So we're doing mostly like some qualitative analysis right now on some of the work, and then we have some larger manuscripts planned for when we're done with the pilot. And just as a reminder for any of the sites that we've been to, please come talk to one of us if you're interested at all in any of the scholarship opportunities. Any questions, please come talk to me. If you have any questions about the project right now or the future of it. And I think, Keith, are you talking next? Okay, awesome. So then a man who needs no introduction, Dr. Keith Coker next.
Yeah. So I'm actually going to introduce Dr. Kristen Swore, who's going to really talk about this. So she is the clinical lead for this in the Corning Center, physician at Hurley. So, yeah.
Thank you very much.
Yeah.
Hi, everybody. Are we all out of our post-lunch coma yet? Okay, I know I'm not. My name's Kristen Swore. I'm an emergency physician at Hurley Medical Center in Flint. I am the HIV screening consultant for Medic and the physician champion for our opt-out HIV screening in the emergency department at Hurley Medical Center. If you have not yet heard about it, and I've had the pleasure of meeting several of you who didn't know about it just yet, Medic has partnered with the Michigan Department of Health and Human Services for a 2-year collaborative with the Ending the HIV Epidemic program. We are a 2-year funded project with a 2-pronged approach to what we're doing. The overarching goal is to increase the amount of screening in asymptomatic or opt-out screening done for HIV in the emergency department throughout Michigan. as I'm sure you all know, the CDC recommends that everyone between the ages of 13 and 64 get at least one HIV test in the course of their lifetime as routine screening. And as you all know, lots of routine screening happens in the emergency department. So this is a 2-year partnership again, and then we have 2 prongs to our program. The first is a learning series. The goal of this learning series is to tell you how to pull off HIV screening in the emergency department, and also to how to teach people, both clinicians and other practitioners in our partnership, as well as patients, to overcome barriers and decrease the stigma to routine HIV testing and make it much more like routine blood pressure screening, routine diabetes screening, and take away the stigma that has long been a part of the HIV and AIDS disease and epidemic. The second part is a QI opportunity. This is what I like to call the boots on the ground thing. It's going to give us opportunity to give you on the ground support for starting an HIV screening program or continuing the HIV program at your hospital, meeting you wherever you are, and to improve whatever processes you have. So we'll talk about the first part, the educational series first. This is the in case you missed it slide. In May 30th, we had our kickoff meeting. The good news is if you're interested, you can look at the link on the Medic website and you can watch the whole thing, or you can look at the parts that are interesting to you. We had 10 different health systems attend, about 50 people, and we talked in general about the program, gave you a brief introduction, and you would have heard from, and you can still hear from, several people who have successful screening programs in their hospital. On the 9th, Kate McComber, who is sitting at our HIV table, don't forget to visit our Ending the HIV Epidemic table before you leave, talked a little bit about how the public health department has overcome a barrier that many of us think is the hard stop to testing for HIV in the emergency department, which is how the health department takes over once a positive HIV case is identified and links the patient to confirmatory testing, counseling, screening, disclosure of results. And again, also available on our website if you want to come and check that out retrospectively. Our next virtual event will feature some other lady that works in the ER. You can register on the website, and we'll be talking a little bit about how to implement the process of HIV testing despite perceived cost and other barriers in order to really lean on that public health benefit that we all went into emergency medicine and we all went into healthcare and public health for. Our events actually will continue well into the next year. So you are welcome to attend any and all of them. And there's, again, stop by the table. We've got a flyer there with all of those and also available on the website. More exciting to me is the QI opportunity, because this is the place where we really start the program and make it run in the emergency department. It's not too late. This is rolling participation. So if you weren't here in May and if you weren't here in October, we welcome you in December and January, whenever your hospital or you are ready to join. Everybody's in different points of readiness. So far, we've engaged with 5 different places, some of which are ready to get going on their HIV screening in their ER, and some of which have committed to learning more. And we've had great dialogues with them. Each HIV screening program at each hospital is going to look a little bit different. A brief example is some of these are automated screenings from triage. Some of these are automated screenings from people who are having CBCs drawn. And if you want to hear more about that, we can talk about it over at the HIV table. There's funding available as well. We have some mini grants available to help launch this program. Once the program is launched, from personal experience, it really is something that sustains itself and is fairly low cost. Whoop. And oh, look, another plug to come by and talk to us at the HIV table. So we look forward to all of your participation. It's been great to meet so many of you both prior to this meeting and during this meeting. Are there any questions?